Jennifer Shepard with the Shepherd Center for Integrative Health. This morning I want to talk about back pain and vulnerable discs. Once we have a disc injury, they're almost always, which we're always cautious to say always and never, but discs just don't heal well. They don't have great blood supply, so once we have some damage, usually we always have a little bit of damage, we have a vulnerability, and we have to be cautious and aware of the things that provoke that disc. And where I want to start with it is, so I've had back pain since age 16. Again, it has been managed fantastically through the Institute of Physical Art, through my mentor, Gail, through the Brawl Institute, all the internal visceral work we've done, internal, external, dural work, and just self-treatment, and know what I need to do to keep myself stable and healthy, and know what I need to watch out for. So I really got my disc into trouble probably back in 2006, 2005, 2006, and it was from a sledding injury. It was just like a lot of bounce, and I probably went for a run after that or something, but again, it was that hot, just nasty disc pain, just that, it's that whoosh, and like you feel it when it comes on. I remember I was treating a patient, whew, wow, this is not good, and just this swelly, fat, ouchy, grouchy disc. I can't remember if I had radicular pain at the time, but again, I do, like when my disc gets hot and swelly, I get a little bit of radicular pain right down the sciatic and the right buttock. But so I manage it well, right? I've had great treatment, so a lot of the mechanical forces are off my disc. I'm cautious of impact. I'm cautious I can't run more than once or twice a week, which I don't run very much anymore, and I'm fine with that. But this summer I ran into trouble, and I might have talked about it in a post. Tubing. I was tubing with my boys, and I really wanted to. It was a gorgeous day, and usually I run the boat, and I had someone to run the boat for me, so I was so excited to hop on the tube with my boys, and knowing, okay, there's going to be some impact, I'm in prone, so I held on, I stabilized really, really, really well, like really, really internal, external, holding everything, pelvic floor firing, my transverse abdominis, everything I could pull in, I'm holding to stabilize it. Who knows, maybe that was my problem, but sure enough, I think it was maybe that night that, whoop, there it is, like that whoosh. And I feel it when I go into flexion, either sideline with my chest, or if I forward bend, or actually when I squat is when I really feel it. So again, that increased flexion, that little bit of increased strain on the disc of that slightly swollen, damaged part of my disc, and then it'll talk to me. So again, it's interesting because that takes a little bit of time for it to just work its way out again. So I pissed it off. It just needs to settle down. There isn't a whole lot I really need to do to treat it. Sometimes I treat AP, but I really just kind of let it run its course. Again, I've done all the mechanical work before that most people have not done. So again, when someone's disc is hot and they have not great efficient mechanics, then yes, we go and we treat that, get straight off the disc. So that's how I personally manage my disc these days. So I'm sharing this with you because I was driving my car, dropping my boys off at soccer, and I missed a curb, and I hit it just wrong. I think I kind of hit it forward and bumped over it, but there was this little bit of jar, and I felt it in my disc, and actually what it reminded me of, right, it took me back to the memory, another disc injury that I just remembered just now as I remembered hitting the curb, which I mean, I didn't stop my car, I bopped over it, but another injury, sledding with my boys. We were coming down the hill sledding, and then my sled hit a curb, so there's this abrupt jar, shear force. My disc absolutely felt that one. It did not like that. So it was reminiscent of that particular injury when I hit that curb and I felt it. So again, noticing it, all right, be careful, don't push too hard. This might swell your disc off a little bit. But sure enough, that was Wednesday. Usually it was Thursday. Thursday I go into a little squat and whoop, there it is, right? There's that little bit of, just that increased pressure on the sciatic nerve from that little bit of swelling of the disc. So I played tennis today, which again, be careful, right? Be careful, your disc is a little swollen. Don't push it too hard because then I can injure it more. Increased swelling and perhaps increased damage, but I made sure I wore my SI belt and I didn't push it too hard. So I just wanted to share, in my experience, here's how my hot disc feels, and I know when it's a disc versus not. And here's where I want to go into other symptoms. So my disc, when my disc is hot and I feel it in the right buttock when it's swollen, is different from what I'll feel when my top of L5, L4 is in a bit of an anterior shear and rotation. And again, that's my vulnerability, my instability, which I've had prolo, PRP, again, it's very, very well. But if I play tennis without an SI belt, all that rotation will kick me into buzz just a little bit, but it's more so the position and what happens at the vertebrae. So here's my little vertebrae. Here's the shear and rotation. That shear rotation it's not efficient position. So we think about the nerve roots coming through and coming out just enough. And again, this is my personal professional opinion experience. You know, what I see in the clinic, what I feel in my own body, and I know my body really, really well, and I've had lots and lots of treatment. So that vertebrae anterior shear slight rotation buzzes my right L4, L5 nerve just enough where I'll feel it chatter. So again, it's not really pain, a little bit, like maybe 0.5, but I call it chatter, and I'll feel it in my thigh a little bit. My whole right lower extremity stability is not as great. So again, when we think about our building blocks, that vertebrae is forward just a little bit, whether neuromuscularly, structurally, probably, yes, all of the above neurologically, affects the alignment. So I'll feel it when I go up and down stairs with my knee. Yep, my lumbar spine is in a bit of rotation shear, so I need to mobilize that to help restore the control and the alignment of the right lower extremity. So this is how we tease out when patients come into the clinic. Again, back to I got back pain. Okay, so first thing in the morning, you have stiffness. Okay, yes, we got some swelling of disc piece. We talk about what happened, right? What forces came in. Was it repetitive? Was there direct trauma? And then when we hear pain with prolonged standing, absolutely we think about that anterior shear. Again, the vertebrae aren't standing as well, or aren't stacked as well. So again, as we are detectives and we're listening to the story and we're looking at the mechanics, we're able to fine-tune back pain. And back pain is one of the most common problems we have in our country, and how much money is spent on back pain. But when we know what to listen for, what to look for, and we know the mechanics, and again, it's not one size fits all. So again, this is how my body responds, but again, it's how I see a lot of my patients respond. Again, where things get complicated is when we throw in some central inflammation. We throw in a statin. Sometimes statins, often I'll see things just feel a little different. Pain just doesn't resolve as well with mobilization. So those are places, and even centralization of the pain. So those are places when things don't quite respond as well. But again, for most people who don't have those other components, when we listen, we understand the mechanics, we know right where to go and how to help them live pain-free. And again, it's not that they'll never have pain again, but we teach them, okay, here's what's happened to your body. Here's the vulnerability you have, right? Let's get tension off it. Let's restore it as much as we can. But how do you take care of your back? Here's the things you have to do to keep your back healthy. And it's so worth it to do it. And we catch ourselves too, like when we fall off the wagon and do our stability work. Yep, that's when I'm more vulnerable. And I feel it too, actually, in my tennis game as well. I finally got back and got into my bridging and my deep stability, the stuff that I need to keep my core, my deep core, my true stability core turned on, and stay in my glutes to keep me out of my lumbar spine. I got more power when I hit. My strokes are better. So it's a win-win for everybody. Thank you for